Welcome to Saving Lives in New Jersey with the COVID vaccine town hall, addressing Asian American communities, presented by New Jersey Department of Health. My name is Janine Llamzon, and I'm the System Director of the Emergency Line in St. Joseph's Health in Passaic County. I am Filipino, and I'm a part of this Southeast Asian community that I love. I am a representative not only of the Asian community, but also the representative of New Jersey. And I'm here today with my esteemed guests, Dr. Hafiza Sheikh, DO, Fellow of the American College of Cardiology, representing Cherry Hill Free Clinic, and a co-founder of Community SJP, serving the underserved community of South Jersey and Philadelphia. And Dr. Naveen Mehrotra, pediatrician and adjunct family member, Rutgers Robert Wood Johnson Medical School in New Jersey. He is also a medical director of My Whole Child Pediatrics and a founding director of SKN Foundation. This is a nonprofit organization working to reduce health disparities in South Asian communities. Hello all. Welcome, my friends. So first, Dr. Sheikh, I wanted to ask you, what do you say are the most common misconceptions about COVID-19 vaccine amongst Asian American communities?
What I've heard so far in our Asian communities in New Jersey, thank you, Janine, for the warm welcome, is there's a lot of doubts as to whether the vaccine is fully effective. I think some people feel that even after getting the vaccination, that they are still at risk of getting the virus. Unfortunately, none of the vaccines are 100% effective, but we do know that there's very strong data, very strong outcomes to say that the chances of both contracting the virus or becoming seriously ill from the virus are all mitigated by receiving the vaccination. So it is very helpful and powerful. I think one of the other misconceptions is that there could be some large degree of side effects. And I know that we'll get into that a little bit in our discussion tonight as well, too. However, the side effects, obviously, they're not predictable. First of all, most people do not have side effects at all. And the side effects that do occur, they're minor, and they're not as significant as having the virus itself, since we know that there are pretty serious implications of actually becoming ill from COVID-19 itself if we're unprotected.
So just to add to that, Janine, so first of all, thank you for having me as part of this Asian American Town Hall. It's great to be connecting to our Asian community, which is one of the fastest growing minority subgroups in the country. And especially if you're in New Jersey, I think it's one of the, probably has surpassed most of the other ethnic communities. So I'm really happy to be here and to be talking to our community members out there. And to add on to what Hafiza has said, that I think the biggest fear that people have is, hey, how come when vaccines have been around for they take 20 years, maybe 10 years to get to the market, here you have a vaccine that was developed in 6 months or a very short period of time. How could it be safe? How can it be effective? And that we're just pushing this to, just go ahead and give money to the pharmaceutical companies, or to go ahead and some crazy stuff that I've heard is that you'll have, these are vaccines that are being put into the people to make neurochips that get ingrained into the brains, and that people are going to be monitored and going to be controlled by our government. I mean, if you actually get on the internet and start reading, which I think a lot of our Asian community is very internet savvy, right? So they go out there and are always researching, and then there's always this talk amongst people back and forth. These are some of the fears that they've had, is like, how can a vaccine that came out so quickly, how can it be so effective to go ahead and combat the pandemic? And I think that's where the biggest fear comes in.
So tying to that question, why isn't the regular public able to make a choice on what the brand that they want to pick for the vaccine?
We who have been in the front line, and I'm sure Hafiza can vouch for this, and you, Janine, would probably know this much more. I mean, the impact of COVID, the mortality that comes in, the fear, the deaths that we're seeing left and right with COVID, are
Mhm.
so scary. It just like blew everybody away, right? So here we have a vaccine that is now there to go ahead and reduce the severity of the disease, can go ahead and save lives, get people out of the hospitals. These vaccines need to be given to the people as quickly as possible. So when these vaccines are being shipped to different vaccination sites, whatever is there is what you need to go ahead and take. And that is why people don't have a choice on what they're allowed to go ahead and select. So the thing is, right now, let's get every single person vaccinated as quickly as possible, wherever they can get an appointment to get that vaccine. And whatever vaccine is available is the one that they should go ahead and get, because all of them are effective against reducing the severity of the disease.
Yeah, and you know what? Like, so I was having a conversation with my parents who are still back home in the Philippines, and there is so much fear not only here in America, and you know, Asian communities. We're one big happy family. Our third generation cousins are still our cousins, and we're not only are we getting information from here, but we're also getting information from what's out there. And I guess how do we frame that conversation? Dr. Sheikh, what are your thoughts about that when we're calling our families back home and we know what's going on in, for example, in the Philippines? There's a lot of people who are dying over there. How do we frame that conversations with our family members to kind of convince them that, you know, this vaccine is good, that this is good for you?
Yeah, good question, Janine. The data is there. The facts are the vaccination is definitely helping to protect, what was hundreds of people, thousands of people, and now thankfully it's available to as many people as we can actively supply the quantity to, as Dr. Marotra mentioned. So the vaccine is effective, it's out there, and if anything, time is of the essence, where the sooner more people are vaccinated and the sooner that people are immune, leads to more rapid safety for everybody. So fortunately, speaking to some family back home in India also, they actually have a different set of options for some of the vaccination companies that are available to them as well than what we may have here, which makes sense. Again, the American FDA has to make sure that things are proven for safety and efficacy. So that's why there could be some differences between what's available there and what's available in America as well. But the most important thing is to really remind people that certainly, as as Naveed had mentioned, the safety has been tested for, the efficacy is there, and at this point, it's required, because the sooner that more people in the community can be safer, the sooner we can save more lives, prevent more illnesses, and just even prevent that transmittivity, the infectivity that's happening from person to person. Because unfortunately, as we learn more about this virus every day, we know that it's so easily transmitted from person to person, not from someone who knows that they have it and obviously that they're willingly trying to transmit it, but rather transmitted by people who don't even know that they have it. So that's what makes this such a dangerous situation. So I think just framing it around the safety and around the fact that we're lucky and privileged enough to have the availability of vaccines that we have at this point, and same thing to them back home as well too, that what they do have available, they need to take advantage of.
And what do you think should we say to our family members or our friends in the community, in the Asian community? One of the questions that we get asked a lot, especially here in the emergency department or in the primary care setting, is, will that mess with my other medications? Like, I'm taking blood pressure medication. Will the vaccine kind of reduce the efficacy of my other medications? Because they take a lot of medications. What do you think about that, Dr. Mirotra?
Yeah, so right now there's no data to support that if you're on a certain on a certain medication that you cannot take the vaccine. So it is pretty safe to go ahead and take that, but we do want you to go ahead and check with your primary care physician and make sure that you don't have any special contraindication for the vaccine. But on a general note, for everybody that's listening to us, there is no data to show that this vaccine cannot be given with a certain medication or that vaccine cannot be given with a certain medication. So you should feel pretty safe about taking the vaccine. And just getting back to the conversation with our people back home, right? My mom lives with me, so she's constantly on conversation with all of the people back home, and every day somebody's talking about how bad the COVID is, or oh, when are, they're waiting for the vaccine, but which vaccine should they get? So what people are focusing on is the number and trying to go ahead and see, can they get the best vaccine? Hey, that's not. I mean, yes, we want that to be the most effective, but these are just numbers that would have come up in the research. We need to go ahead and understand that these vaccines are protective against severe disease.
I completely agree with you because I'm talking to my dad, who is an engineer, a chemical engineer, and he has since been an expert in COVID and just reading on the internet. And I constantly remind him, you have to get your information from the proper source, which is your, medical practitioners. I'm very interested in your work, Dr. Mirocha, with the disparities and the social and the health disparities among South Asians. Do you think are the effects of COVID to South Asians, both in socially and both with their in their health,
So
as a community and as individually?
right, so as we remember when the pandemic hit early on in March of 2020, and as the data started to come in, there were certain subgroups of populations that were at much higher risk for much more severe disease, death, and one of those was diabetes. Type 2 diabetes puts you at a very high risk of having more complications, death, severe COVID that you would be succumb to. So our work in the foundation, the SKN Foundation, is to work around diabetes in the South Asian community. And we have established the first South Asian Diabetes Center at St. Peter's just to address these issues. If you look at the data internationally, diabetes is most prevalent in the South Asian community, where people in India, 1 out of 5 of them are predisposed to have diabetes by in the next few years. Not a great thing to have as a claim to fame for India or South Asia, where diabetes is so rampant. So we want everybody to make sure that they understand their risk factors if they're predisposed to diabetes. And they say if you're a South Asian, you are at risk for diabetes. And if you have diabetes, get proper management for your condition. So at least if you're working to prevent and take good care of your diabetes, you will hopefully be a little bit better off in terms of your care if you contract COVID. So that's one of the biggest health disparities that we see in our Asian community.
So, Dr. Sheikh, and you work also with the underserved in South Jersey. And just continuing this conversation, I guess, how do we as medical practitioners, as healthcare practitioners, evoke the help of community leaders in our Asian communities to kind of utilize or navigate our community to come out and make the proper choices as regards this virus and as regards getting the vaccine?
Yeah, I think it's a good question because again, the more of the community that is vaccinated, the safer that we'll all be. So I work with the Cherry Hill Free Clinic, which is a nonprofit free clinic formed in South Jersey by Dr. Jabril Oyemi about 4 or 5 years back. And one thing that it also targets doing is making sure that there's not as many language barriers as possible too. And I think that's also something that afflicts the Asian American community is maybe not everybody feels comfortable that they can reach the care, but they should know that there are providers out there that are available to be able to communicate with them and answer their questions. And this way also be able to explain fully to them the importance of the vaccination and also just of healthcare in general. So another aspect of the pandemic, besides the obvious healthcare crisis that it's created, is also the financial crisis that has ensued with it. So a lot of people have unfortunately lost their employment or lost their healthcare coverage. So I know that the work that both our clinic and the SKN Foundation that Naveen, you founded as well too, I know that can really come in to help people, especially in times like this and the economy that's been going on right now. So I think one thing is seek resources, especially if you are underinsured or uninsured, that there definitely are resources available because this is a community health crisis and everybody's included in that, whether you're insured or not. I think the other thing is it's an onus on the people that have gotten the vaccination and do have access to regular health care to make sure that their loved ones, their family, their friends are then also seeking and making sure that they have access to the resources to get the vaccination as well. And I agree in the beginning, it was a little bit difficult with navigating these websites. And sometimes there's also a fair amount of people that need help just with the technical resources and technical aspects of being able to get registered on the websites and being able to contact these facilities that are administering the vaccine as well too. So getting the word out, setting a good example of, being safe yourself and getting the vaccination. I think these are all ways that hopefully as a community and the larger New Jersey community as well too can look to protect each other.
Yeah, I totally agree with everything that's been said so far. I wanted to bring up a little bit more on this in terms of our community always being known as the model minority, as highly successful doctors and engineers and healthcare workers and well-off. But as you rightfully pointed out, Janine, in our family, right, we have 3 generations living together. We have our seniors, we have ourselves, and the seniors might be fresh immigrants to this country who don't know how to navigate the system, who don't know where to get access to proper health care. There may be immigration issues. There may be other issues where they're fearful that, hey, I'm here on a visitor's visa, or hey, I'm not a US citizen. Can I go ahead and get the vaccine? And I think over time, the governor's office has been great in terms of changing all of the eligibility requirements. So now undocumented people who are visitors and all that, it's not a requirement to be a resident or a citizen to get the vaccine. So these are all good things. And as a community that is, quote unquote, affluent, we are also very shy about or apprehensive about reaching out to the community-based resources. So the resources that are there, we'll say, okay, no, let me try to go ahead and handle this myself. But we don't realize that, you might be able to get some free healthcare if it's needed. You might be able to get some free unemployment benefits that you may not have actually thought about. So we have to make sure that we understand what our resources are and not be apprehensive about getting them and accessing the healthcare system the way we can, and making sure that we keep our seniors as protected as possible who are living with us in our households.
I totally agree with you. I think the concept that brings to mind is collective caring. We really have to, as an Asian community, being Filipino, being Indian, being Korean, we have to all come together, and with all our other like the Latin, all the other communities out there to seek help, and then maybe these community leaders can come together and create an information dissemination campaign so that we can all collectively care for each other. And that's how I feel about it. One more thing is like the help of our like spiritual and religious sect. Being Filipino, every Sunday we go to church, and having the guidance and like having our spiritual leaders come forward and speak about the vaccine is also very helpful. And I am so grateful that the community that I have, at least in our religious community, has really helped us disseminate the information about the vaccine and actually navigated some of the community members in our congregation to get the vaccine within the county. So I don't know if you have the same experience.
Yeah, I think that's a very useful conduit to get the information out. And I think a lot of the communities have done that. And wherever those spiritual leaders are doing it, I think hats off to them. And we hope that more and more spiritual leaders will go ahead and spread this information. The limitation has been now that since we don't have in-person congregations, a lot of them are not able to meet with their spiritual leaders. So hopefully we can find a way around it. And
Yes.
I don't know what Dr. Sheikh's experience has been on this, but I think it's probably the same all across the board, right?
Agree. In Burlington and Camden County in particular, I know there were initiatives, even by the virtual healthcare system and other systems, to try to get out to the actual centers for religious education as well too, in our area, just to even administer the vaccine. You know, initially it was lectures or mentions and kind of education about why the vaccine is important, but then being able to actually create a small vaccine clinic at those locations helped. But again, I agree, you know, Naveen, kind of limited by the fact that there's a much smaller in-person congregation presence than there was before. But fortunately, some of these congregations are still very well linked in communicating, whether it's moving to an online format, such as Zoom, or at least with just kind of the interpersonal communications that are happening. But I agree, I think these are all excellent avenues, and agree, kudos to these organizations that are able to reach out. It is a shame that disproportionately all these minorities are having lower rates of vaccination and higher rates of serious complications from the virus as well too. But I'm hoping through forums like this, and hopefully through increased education, increased access, that we should be able to hopefully overcome those statistics soon enough. I'm hoping, as a native New Jerseyan, we can move through and get things improved.
Yeah, and I don't know if, in terms of the Filipino community, but I know in our community, the WhatsApp University information
Oh,
dissemination is
absolutely.
horrendous.
It's WhatsApp, Viber, and Facebook Messenger. I get it. There's like 50 people from my family in that one conversation, and we miss the people back home. We miss, and this is what I tell my community also as a Filipino. I say to them that Christmas is an important part of our culture, but then there is a time for us to get together again. Now isn't the time. And maybe if we go out there and maybe we can celebrate Pasko, which is Christmas, together, if we all get vaccinated. So maybe that should be the message, because we love to eat, right? I'm sure it's the same in your culture. We love to eat together. So just going back to the vaccine, one of the questions that's always being asked is that if you did get COVID and you quarantine, when can you get the vaccine?
Yeah, sure. So there is a waiting period. The general recommendation is to wait around 90 days to get the vaccination after you've been ill from the virus. There has been some flexibility in that, so I don't want to say that that's a hard and fast rule. So for example, if you are totally recovered and you're close to the 90 days and there is availability for you to have the vaccination, then there has been some advice from the experts to go ahead and have the vaccination within the 90 days. But generally, that was around the time that was recommended, just because there is a very good level of natural immunity up to the 90 days. So again, not a hard and fast rule from what the CDC has recommended, but that is the general time zone. Naveen, I don't know if you've heard of.
I think just to clarify that, it's 90 days. I don't know a lot of our community if they know about monoclonal antibodies, right? The plasma treatment that they get. So if you are in the very early, stages of getting COVID, and if you're a candidate for what's called the plasma treatment, if you have had that to prevent serious complications from COVID, then they want you to wait 90 days to get the vaccine. But let's say if you've recently had active COVID, or you're an asymptomatic carrier that you found out, they want you to wait at least 14 days, and then you can go ahead and get the COVID vaccine. So just because you've had COVID itself is not a contraindication for indefinitely. So just figure out exactly when you contracted the virus, when you became asymptomatic, what's your quarantine period, and then figure out when you can get the vaccine. But you should be able to get it as soon as the quarantine period is done if you're doing well.
And Dr. Maraudra, just a question about the variants of COVID, because there are multiple variants. So do these vaccines like kind of cover you from and getting protected from all of these COVID variants?
So this is still the million-dollar question, or billion-dollar question, you might say, because new variants keep on coming up that we find out about. And every single pharmaceutical company is racing to find out if their vaccine will protect against a certain variant that pops up. What we know is these vaccines are protective against most of the variants that are coming up, but still the verdict is uncertain. But we can pretty much say safely that there is protection against the variants that are coming out. We don't know as every day new variants come out, what will happen. But for right now, we're pretty safe with taking these vaccines.
So, Dr. Marocha, how do I convince my grandmother?
So tell her you want to go ahead and go back to the country to visit other people. You want to go ahead and get to those big parties that we used to have during holiday seasons. We need to go ahead and get that vaccine into you. We know that all of these vaccines protect you against severe disease, against hospitalizations. The efficacy that is reported out there is based on, was it that how many days they were in the hospital, or what sort of lung involvement they had, what sort of mortality they had. So all those things, and it was not consistent across the various different vaccines that were being studied, right? So what we need to do is get that vaccine into the arm, whatever is out there, to make sure that we protect ourselves against severe disease. And tell your grandma that she needs to get that. That's what I did with my mom. I said, you're quarantined in my house. I'm not letting anybody come into the house. Nobody's going out of the house except for me. I'm a frontline worker. I have to go to work. You have to stay home. When you get the vaccine, then you can go ahead and start to mix. So she got the 2 doses of the Pfizer vaccine, and she's now good. And she is now able to mix with people. So you give them that as
I need to get you on the phone to talk to her because I'm still trying to convince her. Anyway.
Well, darling, but you'll have to translate for me.
True. I guess the other question that, a lot of people ask is, what happens if I don't get the second vaccination for like Moderna and Pfizer, Dr. Sheikh? If I can't get an appointment, or if I miss my appointment, does that reduce the efficacy of the vaccine?
Yeah, so I encountered this just the other day because I had a patient who was hospitalized for totally other reason, but he said, listen, Dr. Sheikh, whatever you do, you have to get me out of the hospital by Saturday because I have my second vaccination appointment, which was great. I was so impressed by his conviction that, obviously he wanted that appointment. He wanted to make sure that that went through. So the truth of the matter is, unfortunately, I don't think he did make it out by Saturday for that particular individual, but his second shot was rescheduled for him. But the truth of the matter is you can't receive that second vaccination sooner than the time allotted, whether it's 21 days or 28 days, depending on the manufacturer, but you can get it afterwards. So say, for example, something happens and you are limited, say you are, in the hospital, God forbid at that time, if you're limited from making it on time to that appointment for the second vaccination, it can be delayed if need be, and then certainly try to get in as soon as you can to get rescheduled for it. It just can't be taken before that time. And of course, the second dose cannot be skipped because you will not reach adequate enough immunity to be protected with just a single dosage of the sequential vaccinations. So that's the most important thing.
Dr. Merotra, does the COVID vaccine prevent you from contracting COVID? Because this is one of the questions that we get asked in the emergency department all the time.
Right. So it does not prevent you from, not getting COVID. What it does do is it reduces the severity of the disease. And we need to understand it. And that is where we're also recommending for everybody to go ahead and stay masked, even after you get the vaccine, unless you're, everybody in the room that you're with is vaccinated. And that even gets into a lot more detail in terms of how many households are in there and, where are they all coming from? Because you could still be a carrier and you could, transmit that to somebody else who doesn't have, who has not had the vaccine or who may be predisposed to other things. And the other thing we have to remember is that no vaccine is going to be 100%. Okay, so even if you've had the vaccine and maybe your immune system didn't build up a proper enough response, you may still be predisposed to getting, a little bit more in terms of the symptoms of the disease.
So it's very polarizing. So the other side of the spectrum is that people don't want to get the vaccine. The other side, who has gotten the vaccine now, started partying and like starting having, your family gatherings. And we have to remind them, we have to constantly remind them that you still have to hand wash, you still have to mask, and we still have to be safe. So Dr. Sheikh, what do you so one of the questions that was asked also is that what if you unknowingly have COVID? Some people don't have the symptoms yet and then get the COVID vaccine. Does that make you predisposed to getting like sicker, or what happens to the person?
Yeah, good question. We 100% don't know the answer to that, obviously, because unfortunately people don't all get tested, within a couple days before they're going to receive the vaccination. But as far as we know, if someone is asymptomatic and has the virus and then receives the vaccination, they should still do fine in terms of a side effect profile, and those other implications. So there's not a lot of data around that. I don't have a great answer to that. And Naveen, I don't know if you've had any experience with that.
Yeah, so it's not necessarily firsthand, but we have heard of reports where people are positive and they didn't realize it and they did receive the vaccine. There's nothing that you can do at that point, but as rightfully pointed out by Dr. Sheikh, that we don't know enough to figure out what will happen. But so far there hasn't been anything in the literature that says that your disease is going to be much more severe or you're not going to be protected and so on. So go ahead and get the vaccine and understand that the vaccine is there to protect you against the severity of the disease. Now, just to get back to the earlier question that we were having about the vaccine itself, when you have people partying and you have all these people in the room who are vaccinated, our Asian community does not party without kids, right? So our kids are always there. And we have to remember that our kids are not vaccinated, right? So under 16, none of these vaccines are approved for administration. So just because you're vaccinated and your kids are there and we all say, okay, yeah, kids are going to be fine, kids are going to be fine, kids are going to be carriers, and they may transmit the virus to somebody else who may then in your party group might end up getting severe disease. So stay masked and continue to keep your social distancing as much as you possibly can, and don't go crazy just because you've had a vaccine.
And I'm glad you mentioned that question. Your statement about pediatric patients, because what we hear all the time on the news or in articles is the vulnerable population is our geriatric patients, and very, it's very well documented. But what are your thoughts about like these kids and like being number one carriers, or also we see a subset of patients that are pediatrics who have COVID?
So we are and sorry to jump in here, but I think the kids are susceptible to COVID. They are getting COVID. Their symptoms are typically self-limiting in over 95% of the cases. Even up to some reports say up to 98%. But there are a small percentage of kids who are having severe disease, who are having something called, the multi-system inflammatory disease that's there. So there are severe complications that can happen. There are reports of death in kids as well. And just because we're saying that kids are safe, that the bulk of the kids are safe, doesn't mean that you should act carelessly. You still have to be careful. And our Asian community is very family-centered, is very family-oriented, and we tend to forget that our kids can be that risk factor for us.
Yeah, and Naveen, I'm glad that you brought that up as well too, just because of our multi-generational homes and households that we have as well too. And that's been well stated, is that unfortunately the grandchildren, and especially because they are less likely to demonstrate overt signs or be as sick from the virus as an adult, that yeah, they unknowingly can be vectors to the grandparents and to the older generation, or even the middle generation who may have serious health concerns. So I'm glad that you brought that up, especially in your own experience of being with your father and your children in the home. Definitely.
I have actually cousins who have type 1 diabetes, or like type 1 diabetics that are adults. Are they eligible? So those are one of the questions that I actually was asked in the emergency department.
Yeah, so they do fall into a high risk category. So that has been opened up. So they definitely are eligible, and I would certainly encourage them, because again, we know that these other certain disease states and what we call medically, we call comorbidities, unfortunately, that these other disease states do all predispose people to having more likely, high risk and significant courses of the virus. So yeah, I would definitely encourage them to be able to come out and get the vaccine.
So,
Thank you.
Janine, you've had like so many questions coming through your ER. It's funny.
I mean, we're
But
the
these are
fifth
good. These are good.
emergency
These are good.
department in the country.
So just to get back to the type 1 thing, initially when the eligibility requirements, the eligibility opened up, um, type 1 diabetes was not part of that, and they said type 2 diabetes. So one of the things that our foundation did, since we focus around diabetes in South Asians, we said, hey, what about type 1 diabetes? And we started advocating sending letters through our legislators, and type 1 diabetes then became included as an eligibility for the COVID vaccine. So anybody who has any sort of diabetes, type 1, type 2, is a high-risk candidate, needs to go ahead and get the vaccine if they're 16 and above.
Oh,
Mhm. Oh, sorry,
what?
Naveen, I was just thinking about, how Janine has a lot of type 1 diabetics in her family, and or maybe even type 2 diabetics. I was just wondering if their sweets are as good as our sweets, but they must
Oh,
be. Does the Filipino culture have a really good dessert scene? Because Indians are all over our desserts.
good job. Yeah, what's little balls? I love
Love
those.
German.
Yes, yes, we do have. We're a bit competitive, but I do love Indian food. So I have to say, we can gather after all of this.
Yeah, there's only one way to really settle that question,
Yep.
right? Yeah.
Yes, like a competition. But the next question I have is, what if we have like a person has a chronic cough? Are they able? So how do you decipher um, whether they can get the vaccine, and what are the things that the person has to do before they get the vaccine, and then after they get the vaccine?
So cough doesn't necessarily mean that they cannot get COVID vaccine. Cough can be a representation as a symptom of many different things. It can be a mild upper respiratory. It can be, allergy related. There's many things, right? So if you are sure that you have COVID, then obviously you wouldn't get the vaccine at that time. But understanding what the nature of the cough is, making sure you check with your PCP, your primary care physician, to understand could this be COVID or not, and ruling that out first before you go ahead and get the vaccine. And similarly, I think there's many other symptoms that people might have that if you're confused that this could be COVID related, you want to first rule out COVID and then make sure you go ahead and get the vaccine.
And like Naveen mentioned, unfortunately, there's a lot of hesitancy when it comes to vaccines for all sorts of diseases. But I think at the end of the day, it's all of our responsibility to try to keep the whole community safe and make sure that people are doing, utilizing the technology that we have and the advances that we're so blessed to have to be able to save lives and save serious illnesses. So, in addition to the mortality that the virus causes, obviously there's a lot of other lingering side effects. There's this whole pocket of what's called the long haulers, which basically means that people who have had lingering side effects, whether it's called the COVID brain fog or just a generalized fatigue or lethargy that's been happening after the virus. Personally, my partner had a stroke that was thought to be related to the virus as well, too. So these are really grave long-term side effects that unfortunately we're still learning about every day and still getting to know. So we have to really operate on what we know and what we have in terms of the data and the studies and take full advantage of that. So I, agree with Dr. Morocha's recommendations and just taking this seriously. And I think the next chapter of that will be the extension to potentially teens and children in a safe manner, and definitely with trials to support that it is safe and effective for them to receive it.
Yeah, and that's all what we can keep on hoping, because every day in my practice, I keep on, parents keep on asking, when can my kid get the vaccine? When can I get my kid the vaccine? I say, hopefully soon. And for everybody that's listening to us today, hopefully you have not been touched with COVID, but if you have, you will never forget something like this. How many deaths we have dealt with, how many people that we know that have been long haulers, that have been, their whole families have been devastated. Don't take this lightly. That's all I can say. Don't take this lightly.
I think we should, I think this is a great culmination. I think that's a great segue to kind of talk about like our own experiences with like battling the COVID crisis, and how our own experience has shaped us to make a decision to get the vaccine. I can personally say that I was in the front line. March 2020, that's when our first patient came in. And I said to myself, being the director of the department, I'm going to be the first one to take care of this first patient, because it was important for me to lead my department and also to lead my staff, and to show my community here in Passaic County that we're prepared for this, and we love you, and that we care for you, and that we will do everything to serve you, but also at the same time your accountability to make sure that you do the proper precautions. And we're here now. It's been more than a year, and I am optimistic. I remain resilient. I remain with grit, and I remain with hope that we can get through this. It's not going to be fast. It's not going to be a sprint. It's a marathon, but we will get there if we just continue to do the right thing. And I hope that my Filipino community and my Southeast Asian community and my Asian community can hear this message, so that one day we can gather again and be together, because I miss you dearly. I miss my family dearly. And we'll get there if we just, continue to spread the message out there. And Dr. Sheikh, what is your message to your community and to the Asian community?
Yeah, I 100% agree with your words, Janine. This is definitely a marathon and not a sprint. And, the fact that we're just learning more about this every day and every week as it proceeds, it's scary. It's frightening. Anything that's unknown is certainly frightening. Anything that affects our loved ones in such an unpredictable way is very frightening. I'm sure that you've all known and had patients and loved ones of patients that have actually passed away or had significant long-term sequelae from this virus. So, we're all in this together. It is certainly frightening, but I think we just need to use what we have in terms of knowledge, the resources that we have available, leaning on each other, protecting each other, just to make sure that we can try to, I'm not going to say nip this in the bud. There's obviously no nipping in the bud that's going to be happening with this at this point, but at least in terms of curtailing and bringing this a closer end as soon as we can, and hopefully not persisting significantly past this year. So use your resources, ask questions, speak to your physicians, be your own advocate. Don't just, pick up a misconception from WhatsApp or from Google or from anywhere. Try to use the facts and make a real decision in terms of both your actions and in terms of treatment and getting yourself screened. But, as it goes with any healthcare issue, speak to your doctor, make a phone call, talk to them, and don't feel hesitant to seek more information.
And Dr. Marocha, what is your message to your community?
I think you guys have said it all. And I will just go ahead and reiterate, let's get back to normalcy, or whatever we consider the new normal to be, and enjoy life, be thankful for what we have, and let's protect ourselves as well as protect everybody out there, and let's get back together to celebrations when we can.
I just want to
with,
say thank you very much. Yes, Dr. Sheikh.
I was just going to say celebrations with lots of Indian and Filipino sweets
Oh, there you
within
go.
moderation.
Yeah.
But
Uh,
I just want to say thank you to both of you. It has been an amazing conversation. I think we've discussed some very difficult topics that a lot of our communities have raised and are very important. And I think we should continue to do this kinds of forums to get the message out there. Dr. Sheikh, thank you for your expertise and thank you for the work that you're doing in South Jersey. I admire it. And Dr. Marocha, I cannot say it's fascinating what you do for the vulnerable. And let's continue doing this because I personally have so much love for the vulnerable population here in my community in Passaic County too. So, for everyone listening today, learn about the COVID vaccine in New Jersey by visiting covid19.nj.gov/vaccine /vaccine. Again, covid19.nj.gov/vaccine. Please continue to do hand washing, continue to use your COVID-19 behaviors wherein you wear your mask, be socially distant with each other, and seek advice. Like Dr. Sheikh and Dr. Marucha said, seek advice from your medical practitioners. You need to make an informed decision. Thank you very much. And thank you for watching. Stay safe, New Jersey. We love you dearly, and we are here for you. Have a wonderful, wonderful day.